about insecure patients?
The periods of remission along with the period of exacerbation, is it characteristic or not typical?
Of course.
Not typical.
Typical, of course.
So it should be characteristic.
The chronic wave course, we'll see, with the progression, the period acute or immune attack and period of healing or remission.
Second,
Desmyelination, connective tissue stages or stages.
yeah, accumulation of associated substances is not stable.
No, it's not stage.
There was a question saying that there is some ends with arthrospastis
And the end,
heart diseases.
deleting the heart disease development, chronic heart disease. Injury. Okay, you're not asking the interesting question about due to rheumatic fever. Some of you that have change of the joints, a clinical case. Second. Not first, the second. About the joints change. Due to rheumatic fever, deformity of the joints develop or not? No. It's different between rheumatic polyarthritis and rheumatoid polyarthritis. The joints injury due to rheumatic fever reversible, not destroyed. Deformity of the joints, not development. To compare rheumatoid arthritis lead to irreversible change of the joints and lead to deformity of the joint. Those it sounds
Doctor, what about a single symptom of
single. No, only one for all group disease. Connective tissue sensitization, of course.
Excuse me, doctor.
The cardiovascular injury is not obligatory for all group disease. Some can development in other disease, maybe basically not involved into the process. That is not obligatory. Those what are there.
So, doctor, is the pulmonary one a type of clinical morphological type of rheumatism?
No, what is the cartilage affected?
No, damage or not damage?
Cartilage.
No. Of course no. And if cartilage not damaged, the deformity of the joints not damaged.
The final stage of rheumatism is it
Heart disease.
Yeah, and this one.
For the polyarthritis,
Acute phase, is it edema, mucoid swelling, or
Fibrinoid
fibrosis?
swelling, fibrinoid necrosis, yeah.
Acute phase.
And chronic changes, sclerosis, hyalinosis, and if you marked vascularization, also possible. Perforation, no. Because perforation is mean necrosis. Necrosis is remission, it's sclerosis, it's remission.
How long is rheumatism? More than 10 or 11 years?
More than 10 years, of course.
more chronic.
It's long
More than
term disease. More than 10 years. Yes. Notes.
Similar questions. Yeah. Some questions.
Group rheumatic disorders. The general characteristic, this is group disorders. There are some main criteria of the some general signs of this is group disorders. And this is changes happen in pathogenesis, all disease from this is group. The first, why? This is disease start. Pathogenesis, why?
Antigen mimicry.
For all disease?
Autoimmune.
This is hyperimmunity. autoimmune disease. Hypersensitivity reaction, hyperimmunity, autoimmune disease. And stimulus for start this is hyperimmunity may be some infections. In case of rheumatic fever, the connection, direct connection between the Streptococcus group A, Streptococcus beta, hemolysis Streptococcus group A, and rheumatic fever. There was a fine connection. But for other disease, no direct connection between the some infection agent and resulting the hypersensitivity reaction. But in general, it results hyperimmunity. And immune system start attack own cells, own body. And those, the pathogenesis for this is group of pathology, autoimmune pathology. Group, autoimmune pathology, organ non-specific because all systemic collagen disorders is called. They're destroyed. Those immune complex, basically, immune complex development and immune complex deposit in microcirculatory vessels, certain hypersensitivity reaction we see associated with vasculitis and adrenal injury. And due to increased permeability of the vessels, what change happened?
Highly nocey.
Inflammation, something later. And
Highly.
Rheumatoid swelling.
and the plasma rate. Increased permeability of the vessels associated with plasma rate. Plasma, together with the components such as the plasma proteins, go out or accumulate inside of the vascular walls and result in mucoid swelling, fibrinoid swelling, fibrinoid necrosis, or maybe progression to hyalinosis and later sclerosis some later. Those fibrinoid inflammation result in fibrinoid necrosis. If injury necrosis happens, inflammation starts. Basically, the fibrinoid inflammation is acute inflammation. But immune attack, one time or repeated, if body start to produce antibody again and start to kill own cells, you cannot stop to kill own cells, unfortunately. And those immune attack continue. And those, if acute inflammation you started, repeated, result in chronic inflammation. The acute inflammation become chronic inflammation. And those inflammation due to autoimmune disease, chronic inflammation. And outcome of chronic inflammation every time, sclerosis. And those, this is chronic wave course of the disease. This is group disease, untreated. Unfortunately, untreated. The aim of treatment, stop progression only. The treatment can stop progression, but cannot return to normal. Stop progression and stop progression necrosis, development again, necrosis and the progression again scarring. Those, what mean disorganization connective tissue? There, previously changed, this is change happened where? In connective tissue into the stroma of organs. Mesenchymal dystrophy, we said it before. And second class, mesenchymal dystrophy in connective tissue and vessels, in stroma of parenchymatous organs and other kinds of the connective tissue and inside of the vascular walls. And those previously type connective tissue provides some function. Its environment, if interstitial tissue in stroma of organ, as the stroma of organ is provides an environment for functional cells, provides some nutrition, provides something connection, interaction between the cells. Due to change to scar tissue, this is scar tissue not doing nothing. To come opposite wavelengths, we can compress something due to progressive growth. Can not connect, provides the interaction between the cells, not can go between the cells. And resulting the parenchymal cells start to dystrophy, and then the organ fail development. And this is change, they're called disorganization. Before organized with something doing, after change, it's chaotically, not organized. And this is background of the change, lead to progression scar and result in organ failure. Those we are discussing again the main criteria, basic criteria, the gene characteristic of this group pathology. Immune pathology, hyperimmunity obligatory, then microcircularity vessels obligatory, those disorganization connective tissue obligatory, chronic weight loss obligatory,
Possible effect of corticosteroids.
and about the treatment. How the aim of treatment we have discussed, stop progression, and those how stop progression.
Corticosteroids.
It's very good, but I want to hear about their point for treatment.
Anti-inflammatory drug.
Anti-inflammatory and immune
Suppressive.
suppressor therapy. Those reduce immune attack and reduce chronic inflammation. And those steroid therapy has wide effect. But different variants of the treatment from to separate for immunity or for the anti-inflammatory therapy also can be used. It's not obligatory. In general, the main points for stopped progression, reduce immunity, and reduce the inflammatory process. Try to stop inflammation. Because if chronic inflammation, every time there are secondary alteration, and then again exudation, and then scarring, again, and anti-inflammatory therapy can stop inflammation. This is possible. Destroy this cycle. No. For this is group disease. This is science for all group disease, and for not easy. Depend predominant organ damage. This is group disease classified, subdivided into some different diseases, several disorders. Those first disease, rheumatic fever. What predominant organ injury? Heart. Blood vessels every time. Heart, cardiac vascular form. The heart, approximately 80%. Sometimes, no, it's approximately 80% person who develop the the rheumatic fever develop the cardiac form, cardiovascular form, with a heart injury. And those means irreversible change in heart. Different layers of the heart can be injured, endocardium, pericardium, or pancreatitis, if only. And again, what change will be in acute or immune attack? Inflammation, necrosis, the mucous swelling, fibrinoid swelling, edema, necrosis, and inflammation. In scarring phase or healing phase, remission phase, the progression scale about this. And on the stage of the endocarditis, valvulitis, acute water endocarditis, fibroblastic, and recurrent water endocarditis. Valvulitis, swelling, edematous, swell, no necrosis, no change before. It's mean. Then acute water endocarditis characterized with the necrosis on the surface. Due to endothelial injury, due to necrosis, some blood clots can be deposited. And VARTI, its mass on surface of valves or endocardium, and resulting the aggregation, necrotic mass together with the platelet, together with the components of the blood, and some additional mass. After this is acute phase, remission phase, fibroblastic. And then if next time will be necrosis, it's called recurrence. Now, water endocarditis. All of that. Water endocarditis.
What includes in the remission phase?
Remission fibroblastic.
Pardon?
Now, when the fibrosis, when the scarring. And then every time will be later. Every time acute phase of rheumatic fever or attack rheumatic fever will be associated with the necrosis, water endocarditis, the healing associated with the fibroblastic. Those myocarditis, different variants possible, nodular, diffuse, etc., and resulting cardiac cirrhosis, and again, chronic heart failure. Pericarditis, different variants possible, serous fibrinosis or fibrinosis, depend severity, permeability of the vessels increase, and resultant complete resolution or organization also possible. In case of fibrinosis, serous fibrinosis, organization possible. And due to exudate organization, maybe spikes inside of the pericardium cavity, and sometimes still complete obliteration cavity of the heart, pericardium cavity, complete close. Again, resulting heart failure, because heart can't pump. Sometimes can be calcium lymphocytes, and this is scarring cavities and result in the most severe complication when the heart cannot pump because calcium around. Only cardiac surgery can help.
Ma'am, during pericarditis, is classification of connective tissue possible?
Calcification possible in any case of dystrophic process. In valve calcification possible, of course, also. And this is specified the valves also cannot open, cannot close. It's in the more severe dystrophic process. Next. Now in the course of this screen about cardiac form. Polyarthritic form. Now we have some discussed before. Polyarthritic form due to rheumatic fever. Basically damage. What kinds of inflammation? What kinds of inflammation? Serous or possible serous fibrinosis inflammations and so on. And those serous inflammation outcomes we discussed previously at semester. It's restoration. Few amount of the proteins, no color, few amount of inflammatory cells, result in complete resolution and restoration. And those destruction of joints, not development, and cartilage not destroyed, deformity of the joints not development. Some signs, basically damage, the patient develop pain in the big size of the joints, and sometimes the patient can say it about symptoms such as that fly pain. Today, one joint pain, tomorrow, other joint pain, after tomorrow, so joint pain.
That fly pain.
It's called symptoms fly pain. Fly. Those. It's absolutely not same to the rheumatoid arthritis. Next form, nodular forms. It's resulting in the skin injury. We say the many disease from this group associated with the skin injury. And rheumatic fever also, but not main organ for rheumatic fever. Possible, why not? But not main. There are also nodular inflammation, connective tissue disorganization, some nodular inflammation, maybe around the joints, maybe in different localization. And interesting cerebral form. Brain injury, also for many diseases from this group. white brain injury. The vessels. And those connective tissue absent, connective tissue disorganization and brain not happening, but vessels injury and resulting hypoxia. And those cerebral formations mean predominance injury of the brain due to changed vascular vessels inside of the brain and resulting hypoxia. The change, this is variant of disease, rheumatic fever for children frequently. The cold, what is the cold? No, this is science. Hyper. Korea. Or maybe sometimes called such as the Saint Vitus dance. The hyperkinesis, involuntary movement of the extremities, emotional disbalance, emotional, and resulting again hypoxia, the brain hypoxia. The next disease, rheumatoid arthritis, and those about rheumatoid arthritis. Now there are the three types. In classification, there are three types rheumatoid arthritis: serum positive, serum negative, and juvenile rheumatoid arthritis. Serum positive, serum negative, and juvenile. Serum negative, serum positive present can found antibodies into the blood or cannot found antibodies into the blood, and rheumatoid factors. Approximately 10% of the patients with rheumatoid arthritis not blood test cannot reveal antibodies. Sometimes, and this is cause of disease more long. It's not meaning absent, absolutely absent, but no in unknown reasons why. Those and the juvenile variants of arthritis. This is rheumatoid arthritis for child. Basically, rheumatoid arthritis start between 30-60 years, and but some of the case possible during the childhood, and this is called the juvenile variants. Joint injury. Then cartilage, and then synovial membrane will produce synovial fluid. Due to immune attack, what leaves injury first? Synovial membrane. That synovial membrane destroyed. Again, because swelling, fibrinoid necrosis. And in case of first stage arthritis, can be found necrotized mass. And this is necrotized mass called rice bodies. Some necrotized mass can be found in the blood. Due to necrosis, start inflammation, and then start after necrosis. And sclerosis. Should we start sclerosis? But if you remember sclerosis, the progression of scarring, the regeneration part, proliferation and maturation. Proliferation, the scarring, starts from the granulation tissue formation. Granulation tissue, it's what? Granulation.
Collagen.
Granuloma-like. This is granular surface due to
Collagen.
Cartilage destruction. Fibro.
granular nose tissue. Wound healing. Some inflammation on what? It's called. But what means granulation tissue? It's young connective tissue. Young connective tissue will contain many vessels. Intensive reddish color. And primary, the wound healing and scarring also. Now the wound healing. The primary intensive reddish color, the scar becomes. The nose very dense, some elastic, because no many collagen fibers, elastic fibers, a few amount of the collagen elastic fibers, and many vessels. And the surface due to many vessels, intensive reddish color and granular surface, the rough surface. And those is called granulation tissue. Those. And there's this stage also develop primary granulation tissue. Many vessels. And this granulation tissue wants to connect with the, it cannot grow in space, of course. It cannot grow here in space. Try to connect with the cartilage. And vessels grows inside of cartilage. What is the change in cartilage if vessels invasion grows in cartilage? What happens with the vessels? Oh, with the cartilage. Destroyed. And this is changed when the granulation tissue develop and continue to destroy cartilage. And this is granulation tissue called panos. It is panos. It is step of the scarring progression. The granulation tissue more progress, and this is also more progress, and the cartilage progress destroyed. Then maturation happens. And resulting the last stage, also stage of the arthritis, fibro-osseous ankylosis development. The cavity space reduce, and the complete close. It's called ankylosis. The movement of these joints not possible. Deformity of the joints happens, of course, because such is the fibrous tissue. Due to the weight, due to the other physical actions, the joint deformity. The same change can be into the surrounding tissue. Around the joints may be rheumatoid nodulus formation, into the skin also. Rheumatoid arthritis starts into the small joints, basically symmetrical in small joints of feet and the hands. Then, when the more distal joints destroyed, start destroyed next joints, more proximal. When this is destroyed next. From small till medium size, and sometimes in severe case possible till big size joints later. But after the injury and the small size joints.
This granuloma, is it the same thing with the granuloma that forms together in Langhans cells? Granuloma, like it's almost granular tissue.
Granulation tissue look like the granules, and granulomatous inflammation. This is kinds of nodular inflammation. Same Pathological process difference.
Okay, thank you.
Such as what also about lymphogranulomatoses. That look like granulomatosis inflammation, but it's tumor, non-Hodgkin disease. Name same, pathological process absolutely different. Those granulation tissue because granular surface look like.
Excuse me, doctor, does it stick to the bones?
Explain what? What did happen into the bones? This is if severe injury, basically bones, the erosions of the bones and continued bone destruction also possible. But to compare it with the cartilage, the bones more strong for destruction. The bones can continue destruction.
But then rheumatoid polyarthritis, what happened other than this thing?
Rheumatic,
Polyarthritis.
polyarthritic forms. The synovial membrane, only immune attack, synovial membrane without necrosis. Only serous inflammation. No fibrinous inflammation, serous inflammation. That's all.
That is reversible.
Reversible. And cartilage not destroyed. No, inflammation happened, inflammation without.
Without inflammation.
And those that fly pain because not destroyed and those not constant pain. Constant pain and viscid joints. Because results inflammation, viscid joints and not injury. Tomorrow maybe next joint. Those extra articular lesions, rheumatoid arthritis. What other organs can be injured?
Lungs.
Lungs,
Kidneys.
kidneys, myocardium, heart.
Lymph nodes.
Not involved into the process because it's hypersensitivity reaction.
Kidneys, eye.
No, spleen is like the lymph nodes. This is involved in process due to hypersensitivity.
Mouth in surgery.
About eyes and mouth,
Surgery.
the Sjogren disease and Sjogren disorders, or sometimes you can find syndrome, the name syndrome, because it's additional. It's additional pathology which obligatory associated with other autoimmune disease. It's not developed self. It's developed together with the other autoimmune pathology. Frequently, rheumatoid arthritis, but other autoimmune pathologies such as Hashimoto goiter possible, autoimmune hepatitis was also possible, but most frequently together with rheumatoid arthritis. And it's continuous, same change which we discussed before. The progression, mucous swelling, fibrinoid necrosis, scarring in stroma, saliva, and lacrimal glands. Results? No. Function? And some other problems. Some other problems. Also, the thumb moments. Deviation is in deformity of joints. Yeah? Deviation because the deformity of the joints lead to the cannot to move. This is fingers, yeah? And resulting there it's due to muscles. Muscle contraction, and those joints cannot return to correct place. It's also symptoms. Symptoms of unhealed. What I want to say? Other variants in your lecture book? No, I mean, because we prepared the new variant of the lecture books and the book and the change to modern variant classification. And those you had some different variants of the rheumatoid arthritis. Now it's not different variants rheumatoid arthritis. Now it's associated disorders. Kaplan syndromes, the Bell syndromes. Yeah. This is no type of rheumatoid arthritis. It's rheumatoid arthritis plus other disorders. And those, it's absolutely now, it's absolutely other. The types of rheumatoid arthritis were discussed at the beginning. Seropositive, seronegative, and resistant. There are three main types only. This is very young. Other, it's absolutely other disorders now. The study pathogenesis, study some changes, and besides, it's not. It can be together. That's absolutely other problems. And those not to get you to study, this is position. Those. Так. Ну, approximately 1 hour at the beginning of class. Да, finish. Ну, давайте тогда finish rheumatoid arthritis and then break. In animation, pay attention to general characteristics of the rheumatoid arthritis, and also interesting to explain the pathogenesis, the significant genetic reasons, and some additional predisposed factors acquired. You can find video on YouTube.
While the term rheumatoid arthritis means inflammatory disease of the joints, the condition of rheumatoid arthritis is in fact a systemic autoimmune disorder where the immune system mistakenly attacks the body's own tissues in various organs.
Possible other. Also then, the action of the important viral organs can be cause of death, of course, and some of frequently cause of death is problems. The kidney problems can be due to virulence of pathogenesis. The kidney problem can be a result of the glomerulopathies. Glomerulonephritis is also autoimmune problems, and in hyperimmunity lead to the destruction of glomeruli. More details about glomerulopathies in topic kidney disorders. Some discuss the level of the injury and why some glomerulopathies can return to normal, but some of them cannot return to normal and progress. Those, but other variants of pathology which can lead to the kidney injury also development. Those, the duration of the disease long, 20, sometimes maybe 30 years. Hyperimmunity every day. Those, what is the type of pathology associated with the hyperimmunoglobulinemia? Every day, there are many proteins, immune globulins produce. And this is proteins due to high concentration start aggregate together with the
Amyloid.
amyloidosis formation. And those, the kidney fail due to rheumatic fever, also due to rheumatoid arthritis, it results amyloidosis of the kidney also. And those type of the amyloid in case of rheumatic fever with the both types. From one side, it's light chain immune globulin, and second, it's chronic inflammatory amyloid together. The complex AA and L amyloid together. And those, it's cause the kidney fail and the possible cause of death. And of course, in case of long time chronic disorders, rheumatic disorders, no, forgot about side effect steroid therapies. Side effect or adverse steroid therapy. Immune suppression, adrenal gland fail, can development, and sometimes it's possible at the cost of death. And other complications, side effects are targeted. Steroid also development, this is some progression, deprivation, etc. The side effects steroid therapy also. TB can start due to immune suppression therapy. It's basically for the risk of they develop long, many. Those. No, and then finish about rheumatoid arthritis. We can say, should say about bacterial disorders or ankylosing spondylitis. Ankylosing spondylitis or bacterial disorders. It's called bacterial disease. This is same change in joints, which we discussed before. There. This is change in joints, but what localization of joints? This is disease specific variants. Now it's also additional disease. It's separate from the rheumatoid arthritis because same, but with some difference. And those are also some different localization of the joints, internal organ involved in process more frequently to compare with the rheumatoid arthritis. Those before in animation also we say the rheumatoid arthritis for women basically. In case of the disorders for men, and till they're 30-40 years, the young men basically. It's not complicated. Women also can develop, but most frequently male, young men. No, and internal organ can be due to deformity of the spinal column. Deformity can be compressed vital organs, can compress the nerves, can compress some vessels, and result in progression, some change in vital organs. Changes in joints, absolutely same. Same stage, same progression, same ankylosis, fibroankylosis development. About this is pathology. After break, continue. Some more about this is pathology and other pathology. But in general, if you remember general characteristics of groups, disorders, it's that you can use this as knowledge for anything. But you should remember what is dominance over there. Stage, change, absolutely same. It's enough for good answer example. from this group can be found thick walls. This is vessels, 1 second vessels. Walls become thick, lumen becomes small, inflammatory cells inside of the walls and outside also. And some of the vessels can be complete blood lumen, no lumen, resulting hypoxia progress. And sclerosis will progress. Acute heart endocarditis, today's slide, necrosis, we said before, necrotic mass, and the inflammatory cells, resulting in the acute heart endocarditis. This is slide, control slide, interstitial exudative myocarditis or rheumatic myocarditis. And you list 112 in your list. Now this is same slide. Same, no, there's some different kinds. You know the different kinds of rheumatic myocarditis possible. Those can be different variants, but same. Can find no high magnification can reveal localization and inflammatory cells between myocardial cells, between in interstitial state, interstitial tissue. What outcome? Sclerosis. And fibrinoid pericarditis. This is one of the examples, right? Not including this is control, you studied for regular control. Fibrinoid pericarditis you studied before, and this is one of the examples. Epicardium, in my slide, epicardium, in your variant slide, no epicardium. No, epicardium present, but in my case, the fat, and you slide, in your variant slide, no fat. Those epicardium, then inflammatory cells, and then fibrin. In your slide, some difference. The old variant of the slide, student, broken, down. Same variant of the slide, stay at exam. Now, your variant of the slide is some difference. This is active process because many inflammatory cells and necrosis start. In slide which you have now, you have more later stage when the inflammatory process reduced and proliferation start. And in your slides you can find not fibrin directly necrosis. You can find organization of fibrinoid pericarditis on the myocardium. You can find thick layers with the start fibrin collagen fiber formation. And the fibrin can irrigate and many vessels inside of the many vessels will be. It's organization. It's complication that we said before. The complete resolution possible, but organization also possible. Now we have prepared a new slide from the museum specimen, and this is more old stage fibrinoid pericarditis, not early stage. Some difference you can see, find in your slide compared with my presentation slide. Not in general. It shows pathological process. It's not. Now this is group of the vessels with the inflammation, thick walls. Now wall become thick and lumen become small till the complete obliteration, and the inflammatory cells surround. It look like the skin glands. This is inflammation around the small vessels. Now, microcircularity vessels injury, we see it before, and this is inflammation surrounding the vessels.
Same thing.
Same, yeah. Myocarditis. many inflammatory cells, diffuse, interstitial. Same. It's not good area. Maybe. Maybe. No. Inflammation present, necrosis present. Again, no, не подойдет. Вот this is. Вот. Oh, return to what? This is necrosis. What? This is area of necrosis. What? But good if together with this is area. No, this is area of necrosis, and no, the good areas if together. The part of necrosis and part of the inflammation. Now, in new part, inflammation present. Edema, inflammation in valves present, but no necrotic mass. This is myocardium, and this is all layers. It's fibrinous pericarditis and organization start, because vascularization start, and then continue. No, it's myocarditis. This is pericarditis. This is pericarditis with organization start. It's inflammatory cells, no. So, such as here. This is many inflammatory cells. This is no. So, many inflammatory cells. And start vessels growth. Organization.
No.
No inflammatory cells, because it's later state, it's organization. It's proliferation start and the scarring start. It's big vessels, vascularization. This is look like granulation tissue. То есть она уже становится look like the granulation. Myocarditis. It's myocarditis. Many inflammatory cells between the cardiac cells. Many inflammatory cells.
All finished.
And most frequently, the kidney problem is a result of the nephritis, and those different types of the injury possible. More details we'll discuss, and whether all the injury we discuss, and glomerular nephritis. In new part, in new case, will be together. Kidney disorders, 1 class. Previous year, 2 class. Those and kidney fail are the possible cause of death, frequently cause of death. Endocarditis also can be development, even sac endocarditis is called. No, systemic scleroderma. What organ injury? Skin. And systemic progression sclerosis called systemic
Skeletal
skeletal muscles can involve in process of recovery, but those their systemic progression sclerosis skin and tendinal organ injury, such as heart, kidney, lungs, liver, beer, etc. And those due to progressive systemic sclerosis, the tendinal organ fail can start. If lungs, it moves into the process. 80% progression, there are fibrosis and resulting the complication due to hemofibrosis. Dermatomyositis, polymyositis is more mild variant of rheumatic disorders, predominantly skin and muscle injuries, but this is group of disease together associated with the other autoimmune processes. Together with the rheumatoid arthritis, together with the systemic rheumatosis, and there is skeletal also. It's include additional injuries.
Systemic lupus erythematosus,
General pathogenic mechanism for development, the impairing immunity, and the chronic inflammation response. Those. Easy. No,
Music.
Those. It's normal. Well, it's not completely normal, but like normal. This is normal valves, semilunar valves of the aorta. The scene, two double layers of the scene connective tissue, no color, transparency, color, and the color thin. If you do something, you can see it. And this is aortic valves due to rheumatic fever. What is the change? This is also it's valve, but change it valve. Да. Those. Sclerosis, they become thick. This the white color. What else? There's some mass deposit on the surface, and this is the rough, the acute, the not acute, the water, and the carditis with some rough mass. And we say the acute phase characterized by the mucoid fibrinoid swelling and necrosis. And all due to necrosis, necrotic mass together with the components of the blood aggregate with the water-like structures formation. And this is case more strong, more fibroblastic variants when the connective tissue grows through this is necrotic mass, and this is necrotic mass cannot remove. Those complications of aquati, the acute phase, additional complication except valve defects due to acute phase, due to necrosis, this is mass can be separate. And those, what complications can be?
Infection.
Where are infection?
Obliteration of the cardiac cavity.
It's in, this is
Atrium.
into the endocardium.
What's it?
If mass rough necrosis happened, what additional complication except sclerosis?
Hydrosis.
Thickening.
Valvular.
Which is associated with the rough mass?
Scar. No.
Valvular.
Embolism. And those due to acute phase associated not only immune attack, associated with the other complications such as the embolism. This is mass not strong. If calcium deposit is good because this is not separate, not this divide. In case of the necrosis, if acute phase associated with the necrosis, this is mass can be separate and then travel lead to the infection in other organs. And infection of brain can development, or kidney infection, or other organs infection, intestine gangrenous, for example. This is group of complications also possible, resulting endocarditis. The cause of the endocarditis. Those the end stage of change of valves, we say sclerosis, hydrosis, vascularization, calcification also possible, additional deposit into the dystrophic areas, and resulting gross appearance, fish, mouse-like appearance. This is become thick, irregular shape, something, and this is valves cannot complete open, cannot complete close, resulting combined acquired valves defect. Combined because together, not open, not synonym, but basically doctors wrote down combined with the predominant, something more severe, maybe predominant stenosis or predominant insufficiency. Those what change in heart due to valve defects?
Hypertrophy.
Hypertrophy at the beginning, but at the later stage,
Dilation.
Dilation together with a hypertrophy, replacement with a dilation, and the heart become big. The big heart, bubble heart development later. Cardiosurgery can help. This is artificial valves. If artificial valves. It's old variants. I think more modern variants, but it's example of cardiosurgery. Of course, surgery can help in case of rheumatic disorders. Can be changed joints, can be changed valve to artificial, can change kidney due to transplantation, but problem not remove. And if change replacement one valves, disease can progress in second valves. If change one joint, disease can progress in second joints. Because problems not only in these joints and these valves, the problems generalized. The problems into the immune system, and the immune system continue to attack. Transplantation of kidney possible, but second kidney transplant kidney also contain connective tissue, also contain vessels, and disease progress into the transplanted kidney also. Though surgery can help, but cannot to complete stop disease. The disease absolutely in other place. Those fibrinous pericarditis, two specimens, that this is normal pericardium, epicardium is normal, absolutely smooth, nothing on surface, and this is due to fibrinous pericarditis. Some rough mass, whitish, I think from this is specimen, you new variants of the slide, because very thick leaves and intensive whitish color show the organization start. Complete. And those, do you remember what is the name, grossly appearance? This is change in heart? Hairy heart, it's correct. Those complete restoration, a resolution possible, but organization, we said, also possible with complete obliteration cavity. Then the complete cavity will be absent. Now, do you have questions?
Yes, doctor. This thing you said is artificial valve, the black thing.
Black, yeah.
But if the valves do like this,
Open.
with this thing,
Black color thing.
it's considered of the two. So it
Can open, can
Okay,
close.
okay.
Yeah. It's not complete close.
Okay.
What other questions? No other questions? Ну, тогда идем сюда.
Huge.
Is this a woman being's
When the cavity becomes big,
So big God, yeah. I wanted to ask if this person is dead. And I remember the person is dead.
Нет, сюда. Ну, у нас посещение музея с разрешением и вместе с преподавателем на занятия.
Вообще интересно, когда вам надо
What's that thing Dr. Nelson said? Increasement in chest. Doctor, would the persons have like this thing Dr. Nelson said? Like someone with this size of heart. Like would the person bigger?
Chest expands.
The deformity of the thorax development also.
Okay, the
organs
development of thoracic
also
compress. Tell you for the name.
affects on the lungs.
When we see later next class about the emphysema, lung emphysema, deformity of the thorax also develops.